marks Mental Health Awareness Month. More and more people now turning to natural medicine, also known as I can never say it correctly. Naturopathic medicine.
Okay.
Thank you. Good
And we're
news.
talking about alternative therapies this morning to help battle conditions like PTSD, healing patients in a really unique way. So this is Michelle from Scottsdale Recovery Center. Thank you so much for joining us this morning. We were just in the break fascinated by what you were saying.
Thank you.
This is what?
So this is equipment used for EMDR. They're called buzzies.
And EMDR is what?
It's eye movement desensitization and reprocessing.
So you're using people's eyes to treat them?
Yes. So essentially when you are doing eye movements, so EMDR can be done in a few different ways. You can use eye movements with bilateral stimulation, meaning I would do this, and you see how your eyes are moving from side to side, or we can use this, which is a bilateral stimulation of your hands, so they buzz on each side. And what that does is it reprocesses memories from the past that are disturbing and presenting issues in the present, so that you desensitize those memories, so it doesn't have, you're not bringing the past into the present.
Michelle, talk about how you have seen really kind of flourish and kind of move over some of these really traumatic issues by using some of these techniques.
So I've had many clients that have had pretty severe trauma in their history. So sexual assaults, physical abuse, and in just a few sessions, they were able to really desensitize the anxiety, the stress, all of those things that come up in those moments or are re-triggered in those moments. And then they really are able to just kind of learn how to decrease that anxiety.
It's fascinating.
It really is. Talk about what a session consists of, how long it is. It's not just you placing these little gadgets in someone's hand. The patient is also working with you.
Right, exactly. But what's great about EMDR is it's actually less talk therapy and more internal. So the whole idea is that your brain does all the work for you. We just guide that process. So we really start with resource building, making sure that clients have appropriate coping skills, they're in a good space so that they can start processing this, because this is a lot of big stuff. And then sessions are usually about 90 minutes. Some events can be reprocessed in one session. Sometimes it takes a little bit longer, but it just depends on how severe it is.
Do you have to keep up with the therapies, or is this something that you do the therapy once, you're able to figure out how to cope and you can cope on your own? Or
sometimes it'll take a little bit more time, because the idea is that some traumas are chained together.